Good afternoon, and thank you again for joining us today. As of 2 p.m. today, there have been 7,303 positive cases of COVID-19, including 314 deaths. Over 74,000 Missourians have been tested at this time. Yesterday, we announced Phase 1 of our Show Me Strong recovery plan, which will take effect on Monday, May the 4th. As I have said many times, this plan is developed with Missouri-specific data and 4 essential pillars to give us a benchmark for moving forward. And they are expanding testing capacity, expanding PPE reserves, continue to monitor and, if necessary, expand hospital capacity, predict potential outbreaks using public health data. Because Missouri took aggressive actions to combat COVID-19 from the start, we are in a good place with each of these pillars and confident that we are ready to move forward. All of the data is important, but one of the most important pieces of information that we track is the number of hospitalized COVID-19 cases and people under investigation. This number is important because it shows how much strain COVID-19 is placing on our healthcare system. Currently, Missouri's healthcare system is not overwhelmed. And I want to emphasize that Missouri's over 7,000 positive cases of COVID-19 is a grand total since March the 7th. Not all of these people are hospitalized. In fact, the vast majority of them have already recovered. The state of Missouri reached peak hospitalization on April the 7th with 1,242 cases. As of April the 25th, the total number of hospitalization has significantly reduced in every region of the state, with the exception of the St. Louis region. The hospitalizations in the Kansas City region showed a 41% reduction. Hospitalizations in the Central region showed a 38% reduction. Hospitalization in Northwest region showed a 41% reduction. Hospitalization in Northeast regional showed a 67% reduction. Hospitalization in Southwest region showed 63% reduction. Hospitalization in Southeast region showed 45% reduction. And the hospitalization in the St. Louis region showed a slight increase of 8%. Again, these numbers represent the decrease in hospitalizations from Missouri's peak on April the 7th to April the 25th. This is why we have to evaluate numbers locally and regionally, not just on a statewide scale. As far as ventilators, we have over 1,100 ventilators available across the state as of yesterday, and this does not include the state stockpile. These are just some examples of data we track and monitor every day to make our decisions. The overall trend is the data show that Missouri's healthcare system is under control. Our hospitals are not overwhelmed, and things are improving, which is why we have made the decision to move forward and begin reopening Missouri on May the 4th. As I said yesterday, all Missouri businesses, employers, and employees are essential to our state. All businesses can open starting May the 4th as long as the social distancing guidelines outlined in our reopening order are followed. Today, we have several guests here to talk more about Missouri businesses as we move forward. First, I'm going to turn it over to Dan Mayhem, the President and CEO of the Missouri Chamber of Commerce. Dan?
Thank you, Governor, and good afternoon. It's great to hear the trends that the Governor is identifying in the healthcare industry and for our fellow Missourians. And it's also great that we see a light at the end of the tunnel for businesses to open. The Governor referenced the potential strain on the healthcare system in the state of Missouri. There has been a significant strain on Missouri businesses that we all know of. We conducted a survey a couple weeks ago at the Missouri Chamber, and we've identified that more than 400,000 Missourians have lost their jobs during this crisis. According to our research, Missouri businesses are expected to lose a quarter of their revenue this year. And 15% of businesses, primarily small employers, are going to go out of business. These are staggering numbers, but we believe that if we come together, we can turn this around. It starts with getting our state back to work. And on Monday, we released at the Missouri Chamber what we call a return to work guide for our state. This guide is based on best practices from around the country that we've collected from fellow state chambers and from the U.S. Chamber of Commerce. And it's a comprehensive way to take a look at your operation if you're in business and how to reopen. We also appreciate the fact that the Governor has posted this on his site as well to help out with that. We are also hosting daily webinars to help employers cope with reopening. Today we started with one on the healthcare considerations that you need to have when you're reopening and getting your employees back in and your customers back in. There are over 300 people right now participating in that. These webinars are helping hundreds of businesses prepare to reopen on May 4th, and we encourage everyone to source the Return to Work Guide and check out these webinars and other things that we can offer to help with retooling the economy. Returning to work is step one, but with 400,000 Missourians suddenly facing unemployment, we know it's going to take extraordinary efforts to rebuild the economy. We believe our state needs to look at innovative policies and take bold actions right now. We need to lead during the crisis, we need to strengthen our recovery, and we need to protect our future, which is why it's so important that we're doing this in the state capitol today, where the legislature has convened again for just a short 3 weeks to try to finish up some unfinished business in the state of Missouri. Finally, we want to recognize Missourians who've truly stood out as heroes during this crisis. These are the people on the front line, the healthcare professionals, the first responders, the people that have dealt with the extremely sick folks that have come down with the virus and have stayed in harm's way to make sure they serve those people in need. For that, we owe them a tremendous amount of gratitude. We also want to thank those manufacturers throughout the state of Missouri and those other employers that have retooled their operation to try to supply the equipment necessary, personal protection equipment, the masks, the gowns, the shields that are necessary. These people took extraordinary actions to help out in a statewide crisis. We believe that both the manufacturers and those that are still standing on the front lines deserve all the protections that we can give them so they don't need to be concerned about liability from opportunistic people that might be trying to find a chink in their armor to sue them for doing the right thing. So lawsuit protection is paramount for this recovery. Like I said earlier, we're all in this together. Let's get Missouri back to work. Let's unite and rebuild the economy. Let's reimagine the economy for the future. And we can end this crisis by beginning to rebuild the industrious, innovative, entrepreneurial, and stubbornly exceptional Missouri that we all are. Thank you very much, Governor. We appreciate your leadership on this.
Thank you, Dan. Thank you very much. And I appreciate all the businesses out there, small, big businesses out there, because there's no doubt in Missouri we will rebuild. and the economy will come back, and it'll be by all of us working together. So I want to thank you, and thank you for the representation for our business community. Also here today with the Associated Industries President and CEO is Ray McCarty. Talk about the manufacturing industry of our state. Ray?
Thank you, Governor. You know, we talked to our members, too, a couple of weeks ago and asked them what kind of things would you look at that would be reasonable in terms of being able to reopen safely, both for your employees and your customers. What are kinds of things that would work in your business? 97% agreed requiring sick employees to stay home until the supervisors, have determined that everything's good or until they test where they can come back to work. 98% supported encouraging frequent hand washing and hand sanitizer use. 98% said frequently cleaning and disinfecting those items that are frequently touched by different people would be effective. All of these things are included in the governor's reopening order, and we think that's very telling about the thought that went into this and the deliberation that went into this reopening order. We think it was very carefully done. We thank the governor for taking responsible and measured approach to this epidemic all the way through. The fact that he was very careful about how he closed the businesses down, allowing local governments to have whatever restrictions they deemed necessary, was very responsible. And we also think coming back and trying to breathe life back into Missouri's economy is very important, and we think the way he's doing it is very responsible. One thing I would mention that I think that aggravates me when I watch press events is that everyone seems to think about the economy as a light switch. And I would beg you to think of it more as a garden hose. You know, we're going to be able to turn things back on, probably a little more gradually. It's not a light switch, and particularly in manufacturing we see that because your supply network, the people who are your suppliers may have either gone out of business, they may have found other customers, and so getting back to normal is going to take a very long time, and we think the governor's approach is a very good one. So I just want to say we're here on behalf of Associated Industries of Missouri to represent the businesses, but also to thank the governor for this very responsible approach and for getting Missouri back to work. Thank you, Governor.
Thank you, Ray. I appreciate it. Appreciate what you represent of the industry out there and how important that manufacturing will be to us getting back on our feet here in Missouri. Another special guest we have today is from the restaurant industry, one of the probably hardest hit industries in the state of Missouri for that. And I just want to say for the restaurant industry in our state of Missouri, the alternative ways that they were able to try to keep their doors open. And I want to thank the people in Missouri that supported them, whether it was the curbside or the delivery services that they added to the restaurants to be able to keep them going in a very dear time, or very tough time for the state of Missouri. And I want to thank everybody for supporting them. But today, we're happy to have Greg Hunsucker with us today. He is the president of the Missouri Restaurant Association, here to give us a little update on the restaurant industry. Greg?
Thank you, Governor. As the governor has stated, I am from Kansas City and serve on the board of directors of the Missouri Restaurant Association. And on behalf of all the eating and drinking establishments in Missouri, and especially those who are members of the Missouri Restaurant Association, we'd like to thank Governor Parsons for his leadership and his forward thinking during these very difficult times. Throughout this epidemic, we have worked closely with the governor's office. Governor Parsons has been meaningful in taking action to help Missouri restaurants, including an executive order allowing us to sell our non-prepared foods directly to the consumer. The governor has also eased many other regulations to allow our businesses the opportunity to bring in some revenue and to continue paying our employees. We stand before you here today in complete support of the governor's plan to reopen the state. This reopening, while it will have restrictions and it will have difficulties for our restaurants, we do believe it is the right way to do it. I can assure you that our members have stepped it up. Our top priority is the safety of our customers and our staff. I can also assure you that restaurants in the great state of Missouri are cleaner now than they have ever been. By following the recommendations outlined by the governor's Q&A, we are ready to reopen restaurants in Missouri in a safe and responsible way. Moving forward, our tables with dining rooms will be socially distanced. We have worked with our employees to implement social distancing and many additional measures to provide a safe environment for all Missourians. On behalf of the 300,000 restaurant employees in the state of Missouri, we are ready to get back to work, to create jobs and to serve meals to your families. It is our hope that the cities and counties throughout the state are ready and willing to uniformly follow the governor's reopening plan to promote jobs and commerce in the restaurant industry. Again, Governor Parson, we thank you for all you've done. We thank you for the support you've shown our industry specifically during these tough times. Thank you.
Greg, thank you very much. A lot of those waivers and things we did to make sure you could sell some of your product from different ways than you used to really boils down to common sense sometimes. It's about helping one another out, and that was a perfect opportunity for us on the state level to be able to help the restaurant industry. And I look forward to going back into the restaurants and sitting down and having a good meal here in Missouri. Like I said yesterday, reopening Missouri will not just be the flip of a switch. This virus is still out there, and we must continue to maintain good social distancing to protect ourselves and others. For our recovery plan to be successful, it's going to take everyone taking precautionary steps to mitigate the risk of COVID-19. So again, let me just say this, use common sense. Follow the social distancing guidelines. Continue to avoid large crowds and gathering whenever possible. Prioritize not just your health and safety, but the health and safety of your friends and your neighbors. We are all on the road to recovery, and we must continue to look out for one another as we move forward. Thank you, and God bless. Also today, Kelly, before we open up for questions, Dr. Williams is here. Also to answer any questions you might have of Dr. Williams. Director Karsten is also here today to be able to answer questions for you. And any of the gentlemen that was up here before, if you want to ask them questions, we are open to that. So time's yours. Kelly.
Question for Dr. Williams. To what do you attribute the fact that the hospital cases in the St. Louis area have not dropped as they have in the other parts of the state?
I think it's just prevalence of the disease. If you look at the number of cases, our first case was in St. Louis County, and that trend has continued since March 7th. And so I think it's just, if you look at the number of cases, knowing that, as the governor said, 80% are going to recover very quickly, but 20% are going to end up in the hospital, and about 6% of those are going to get really sick. So I think it's simply that's where the most disease is, most infections. Thank you.
Dr. Williams, do you have an update on the nursing home transparency plan?
Yes, thank you so much for answering that question. As I was driving over here, it will be up on Friday. So we will thank you for your suggestions. We took that to heart. And starting on Friday, we will announce by county at what nursing homes have had more than 2 cases. We've talked that over with our local health departments, and they're in agreement with that. So that is a suggestion that came from you, and we have acted on that. Thank you.
Hi. How will the state use the test swabs bought from private labs?
Well, right now, what we're doing is we are using both private labs and our state lab to do a lot of testing. As you know, we're doing that up in Buchanan County as we speak. We did 600 and something yesterday, and I think another 500 today. We're looking around the state, doing a snapshot study using 4,000 of both commercial and private swabs and kits this week, which so far has been very reassuring. And so what our goal going forward, and what we call a comprehensive testing strategy in June, July, and August, is to use those tests to do surveillance and to be able to handle outbreaks. And that's not even including the antibody testing, which the governor and I were just talking about, which is that technology becomes more validated, will also have a huge part in how we approach our comprehensive testing strategy, which, as you know, is one of the pillars that we put into place as conditional to reopen.
On your website, it seems like the hospital reporting numbers are on the low side. In some cases, they're only like 49 out of 120.
Yeah.
Can you explain that?
Yeah, Kirk. Again, we take that from the Missouri Hospital Association. At times we get, 127 reporting. I think what you're seeing there more likely is as the incidence has gone down, people are not as compulsive to report it, outstate especially. But we track that very closely with the Missouri Hospital Association, and I was talking to Herb Kuhn about that today.
I have one more. And why did you change the sources of the hospital space availability, like where you pull your numbers for hospital beds and hospitalized patients?
I'm not sure I understand the question. I mean, we've been using data from the Missouri Hospital Association about the number of beds that are available, the number of ventilators that are available. You just heard the governor say that we have about 1,100 available out of 2,100. And again, can't reiterate enough, testing can vary on different things, how many tests you're doing, where you're doing them, but hospitalizations is a great measure to see how you're doing, and certainly that was a key factor as we looked around the state, because always when you look at all this, one of the great questions has been, are you going to reach a surge that overmatches your capacity to take care of people? And I'm very thankful we never reached that. As you know, one of the White House criteria is crisis care. And we never entered that in Missouri. We never reached a situation where people were having to implement new rules because to take people off ventilators, to put other people on ventilators. I think due to some very good planning and some very strategic partnerships, we never reached that in Missouri. Thank you.
Let me just add one thing to what Dr. Williams said there. Again, I just want to say we have a tendency to do this is you use one day to say, okay, only 49 hospitals reported. The truth of the matter is that changes daily. That's why all these stats you have to look at over a long period of time, just like you do when the positive spikes in there. It all depends when the reporting's done. So tomorrow there may be 120 plus hospitals report. It changes daily. That's why it's so important to really make sure that people understand the facts of the data that goes over a period of time instead of just a one-day report, because it doesn't give a just view of what's really happened with COVID-19 in the state. You're going to have to speak in the microphone.
Okay. You release guidelines for businesses in Missouri. How are these going to be enforced, especially in restaurants and bars where typically people are, in close proximity?
Well, I think the two ways they're going to get enforced. They're going to get enforced by the owner, and they're going to get enforced by the people that go there. Because I think they're going to want some expectation that they're safe to go in there, and they're going to make sure those businesses are providing what they feel to be that comfort level. The legal side of it would be on the local levels. You'd go through the health departments, whatever it would, and you'd go through the courts to do that. So there's a mechanism in place for that. But two things, I think demand is going to take care of a lot of this because people are going to want to go where they feel safe. And I think you'll see a lot of that. But there's about 3 steps to that. But I think everybody will own a piece of it. The business will, the consumer will, and then the regulatory side of it. Kurt?
The president is expected to order meat plants, meat processing facilities to stay open. What do you think of that? Do you support that idea?
Yeah, I think that's a good thing. Whatever we do, we got to keep the food chain going in the United States. And for Missouri, it's a huge issue here. So, yes, I want to see them open, and I want to see people going to work and making sure we keep that food chain moving.
I know that you have addressed some things regarding state employees, but I was talking with a constituent who is employed by an agency that's contracted by the state to offer services for developmentally disabled people. She mentioned that she hasn't had any luck getting PPE. They are not being offered any hazard pay. Is there anything that you're doing for agencies that are contracted with the state to offer these?
We've taken all the precautions there is, taking care of the people we're looking after, especially on the state level. I don't know about subcontracts, though, who's doing what there. I'm not even sure which department you're referring to, but as far as I know, we're doing everything that we should be doing for the people that work for the state of Missouri, trying to do the best we can to protect them. And then anybody that's coming in contact in those particular jobs, I would hope we're taking care of them as much as we need to take care of them. And then if she's subcontractor, I'd say probably whoever she's contracted with probably has an obligation to provide her equipment also.
Unemployment has gone up again. How quickly do you expect the unemployment numbers to go back down statewide?
Oh, I wish I had that answer for you, but I mean, it's going to take a while. But the quicker we get back to work, the quicker people go back out there, the quicker people get confidence to go back out and get involved in the economy, I think those numbers are going to change. I'm still optimistic the third and the fourth quarter are going to turn around in the state of Missouri. I think this second quarter is going to be tough. But I think if we can get people back out and people spending money, going back to work, drawing their paychecks, I think we have a lot better chance of the economy picking back up at a faster pace than you would see on a recession-type economy. So I'm optimistic that we're going to move forward before the year's over.
Yesterday, when you talked about the reopening businesses, you mentioned that there may be a possibility where some businesses may be required to have protective equipment. I think specifically hair salons, maybe gyms were mentioned. Do you have any more details on that, one? And two, will the owners be responsible for supplying that?
Well, I would think, yeah, the owners, if it's a private sector, they would be responsible for making sure their employees are taken care of. But I would think if you're going to be in personal contact with somebody, we're going to have the suggestion for sure, the guidance to say you need to wear some sort of protective gear, whether that's a mask, whether that's rubber gloves, I don't know what it might be, but yeah, all of that's going to be done. But yeah, it's going to be up to the owners to provide that. And again, it's going to go back to customer. You know, if that customer don't come in there and don't feel safe, they're not coming in to do business with you. At the end of the day, as a business owner myself, you're going to do everything you can to make sure them customers come in your door.
Are you concerned about social distancing in the House of Representatives, one floor up, when they're sitting on the floor, shoulder to shoulder?
Well, I would hope the House of Representatives, I would probably call that essential. So I would hope that under the requirements that they have to go in there and represent the people of the state, they're going to have to do that. They have to, they make the House and the Senate make their own, I want to say, requirements to how they meet and how they come into this Capitol, and that's up to them. But, they need to be doing, they're here, they're doing their job, and that's what they need to be doing. All right, well, thanks everybody today. Thanks everybody for being in, and appreciate it. Thank you.